So I guess I would start with saying to both of you, we have a real epidemic of head injury and concussion. We have people that have PTSD, which is an emotional concussion. We have people that get reactions to anesthesia, which is a chemical concussion. And we have, of course, the physical concussion with the coup and contra coup injuries, where somebody gets bashed and the opposite side of the impact gets them a concussion-nitis or focus. And so I wanted to hear what you guys are into with regard to some of the more novel assessments and ways of figuring out, first of all, that somebody has a concussion before we move on to how to treat it. So we can start with Bill if you like. What are some of your more creative ways of assessing concussion in some of these people?
Well, the first thing is when I'll see them come in is like that. I'll look about just how they're kind of ambulating, not only just like how they're actually walking or walking around like that, but sometimes there's like a lag time. They're looking around, they're not quite there. Then I'll just ask them questions. How are you feeling when you get up in the morning? And the way they best describe it is I just feel disconnected from myself, almost like they're having tracers that they're just not right in sync with their thoughts, are not in sync with their body. And then from that point on, I'll go through the questions that we've talked about before is like, well, how do you do with blue light? Do you get, one of the biggest things when I'm uncovering stuff is when, a lot of people say, no, I'm fine. I think they're rooting for themselves to be fine. And I'll just ask them something. And the number one thing that I get through is like, do you get tired when you're driving? And they go, well, yeah, but I'll get tired. And then they'll throw in some excuse. But the screen time and the driving, a lot of time, because they don't have that general stimulus going on, and then they just kind of take off. Their brains, you see that all the time with the QEEGs, is their brains are not functioning right. And then from that point on, I'll do some basic exams. We'll look at the eye movements that we've covered, Romberg's test, getting three, a lot of the limbic cerebellar tests to make sure that how they're functioning around. And then at that point, I do the first line of that I do. I generally put them on some magnesium, some turmeric, something along that line, clean up their diet, make sure they're not getting, that they're eating really clean, so they're not having any of that agitation. And I'll check in with them, make sure they're doing okay, maybe the ACE testing, but then usually I'll send them off to you or Jeff or something for a little deeper level to see what's going on, because I can't see the inside.
Good. That's fantastic. Well, Bill, I forgot to have you do just a brief introduction. We don't know which outlet this will go out on, so give us just a brief introduction of your work and what you do, and where you are.
Yeah, so I'm Dr. Bill Janeshak. I'm a trained chiropractor. I like to focus in on functional neurology and functional medicine, which just means that we kind of dive a little bit deeper down the rabbit hole. I am engaged personally and professionally in health and fitness, and I'm a geek enough that I really enjoy finding out what makes everybody tick, so everybody can tick to the best that they can. I'm located in Yorba Linda, California, and I've been there for 25, 27 years. Getting older as we speak, but because we try to take care of ourselves, I'm getting older stronger. So those kind of things. I like to think of myself as a holistic scientist. How about that? So I'll go into the woo, but we want to have some data behind it as well.
Marvelous. Well, we all know each other, but not all the audience knows us. So, Dr. Gross, give us a little introduction of what work you do and where you're located.
Well, I'm Jeffrey Gross, and I am presently located in Henderson, Nevada, and Newport Beach, California. But through the magic of Zoom and other technologies, I can be in your living room, if invited, of course. I started out as a simple country neurosurgeon. I have a spine fellowship, so I was enamored by neck and back treatments, and I have been moving over my entire career towards less surgery, less implants, and more general anti-inflammatory health, longevity, and health span. And more recently, over the last 3 years plus, went back and retrained in regenerative medicine. And now I'm a big fan of what the stem cell type biology allows us as physicians to offer. I am a big fan of all the different anti-aging type behaviors and lifestyles and other medical or paramedical type treatments that Dr. Janeshak was mentioning, because those will form the basis of my answer to your first question.
Yeah, well, we're dying to hear now. So give us some idea of I know we started with assessments, but because you brought up the stem cell line of therapies, can you tell us more about what kind of things that stem cell therapies and stem cell based therapies might offer for concussions and brain injuries and spine injuries of the spinal cord and brain?
Well, if I can go backwards a little bit, the word concussion, we all throw it around and use it, but really we're talking about injuries to the brain and inflammatory changes that the brain would have undergoing to try to heal those. The problem is, unless we're super young and our stem cells are fully functional and active, that inflammation can become chronic, and that is a problematic inflammation. That's the pro-aging inflammation called inflammaging. So when Bill was talking about anti-inflammatory behaviors, clean diet, brain relaxation, all the different things, and I didn't mean to diminish it. The list, we could go on for hours about how to diminish inflammation in one's life, which is called epigenetics. The entire design to treat a brain injury is to limit the inflammation. Most of these inflammatory changes and injuries occur where the gray and white matters meet, because they have different densities and they shear and pull against each other. And that very disconnection type symptom or syndrome that Bill was talking about is a real thing. And these are interrupted white matter interconnectivity patterns through the neural networks of our brain, from lobe to lobe or in between, within a lobe. And we have this very intricate network. So to reduce inflammation, improve healing, there are regenerative biologics to help people heal like they would if they were younger, because a very young person with a concussive brain injury, for which we're using the term concussion, is going to heal better, faster, and longer than someone of my age. So the way to attack that is to help put someone's cells, even someone's stem cells, that programming back the way it was, even temporarily, while they were younger. If I can make a quick analogy, and then I'll get off my soapbox and let you drive. But a 3-year-old child is playing outside in the summer, skins his knee on the sidewalk. They have an abrasion. They're crying. You put some Bactine on the knee. You put a bandage. You kiss the knee. They're better. 3 days later, that scab is gone. Whereas if we fall and scrape our elbow, that the bruise and the scrape will be there 2 weeks later, still healing. So the idea of the biologics we're talking about, whether they be stem cells or stem cell signaling factors like extracellular vesicles or exosomes, these are designed to give someone who is 60 years old a 3-year-old healing potential temporarily. And there are methods to do this rather simply because, for example, exosomes do travel across the blood-brain barrier where stem cells do not. So we do have the ability, the biologics exist, and we're learning more about it. It is cutting edge. It is not fully studied. And of course, some of these are not FDA approved, but they're also not FDA unapproved. So they're worth looking into and understanding the options.
Wow, that's wonderful. So, just because something isn't FDA approved for a given disease doesn't mean that it isn't useful and that it isn't quite safe. It may not be proven effective yet for a particular disease, but it doesn't disallow it or make it something that you can't use or something that is dangerous. Is that right?
Well, I'm not a regulatory expert, and the FDA has declared that they do have jurisdiction over these regenerative biologics, but it's constantly changing. And the best thing to do is to have a full and informed consent, and make sure no claims are made that something does treat or cure a condition or disease when the FDA hasn't blessed that particular language.
So if I want to, as a patient, come in and I want to get these therapies, I can ask for them and get them. I just can't be under the impression that they're treating disease.
Generally, that's true. Again, the FDA has jurisdiction, but patients should have all the options spelled out for them and have the tools to make the right choice for individual needs. And sometimes that requires cutting edge approach, and particularly when approved therapies are not super effective.
Okay, yeah, that's wonderful. I mean,
we can also find out if we go outside of the United States for our information, because Germany, like for stem cells and the like, they've been using for years. And what is it? Was it Costa Rica or there's some other country that we had a lot of the research. I've had stem cells in my office for 3 years. We have other people that come in, they use my office to for stem cell treatment, and it's amazing. I had them done a couple of years ago, and I'm generally healthy. I don't have a lot of symptoms, but it was like brainless to me to go over and not invest in my health based on what I do and my lifestyle that we're living, to not invest some money into the regeneration. I think that's the future. The work that like Sinclair's doing is he out of Harvard, and about the regenerative medicine. And I think there's going to be a certain sect of people that are really getting it, that it is the long-term treatment that we're looking for, and we've got to start investing in our health. I think I don't know where we're going to post this, but I think the curtain's coming back, and it's not just going to be, a few people screaming from the top of the mountain what the truth is, but I think as the people go in, they're looking for these treatments. There's no amount of money that they won't spend to have their life. We talked previously about happiness. If you're running around in a meat suit that is less than par, how are you living your day to day? This is why the brain and the concussive stuff is so interesting to me, because I remember when I had a seizure disorder, when I would come out of a seizure, and how I felt, and I didn't want to feel that way. And then I had COVID in December. I hadn't been sick in 25 years, and then I got that, and I remember what it felt like not to feel like my brain was part of my own. So I think the work you guys are doing is wonderful.
sure.
And I'll get off my soapbox now, because I would have went on forever.
Oh, no, thank you. You're absolutely right that Europeans, the Central America, these were locations over the last, let's call it 15, 20 years, who have not been as hampered as we have here in the US. And we can talk about the reasons for that if you want, but people would often, a decade ago, go to Europe or Panama or Costa Rica to have a treatment, and that's a known thing. Now, quietly, the Chinese have been, heads and shoulders above in research, and they tend to be very bold in what they try. And there's some wonderful literature from various Chinese labs on different uses of these regenerative biologics. And I use that phrase instead of stem cells, because people come in and ask for stem cells, but there's more than just stem cells.
Mm-hmm. Yeah. Yeah, you're right. This was my experience even 15 years ago when I was leading a coma recovery team in Minneapolis. We had patients that were sent to the Dominican Republic for their stem cell and other stem cell line therapies because you just couldn't do it around here. And so if I were a patient and I came in and I said, I've had a concussion, I've had a head injury, I've had a brain injury, I've had a mild traumatic brain injury, nothing that quite opens up the skull, but a closed head injury. And I know, yes, that of course it's not accepted orthodoxy, but I want it anyway. And I want to come in. What else can I do in my lifestyle to support the effectiveness and the lasting effects of that kind of therapy? Is there anything I can do with my lifestyle, with my diet, with what I do with myself to make this last longer or be more effective?
Yeah, I'll
Dr.
jump
Gross,
in
what would you say about that?
So I advised someone earlier this morning of the very same issue. I said, first of all, the brain needs to rest to heal, and it needs to have reduced inflammation. So first and foremost, one can consider a ketogenic diet. These diets have been used to treat epileptiform problems, seizures, because they do reduce the neuroexcitatory activities. So if we can reduce excitotoxic activities, we're also reducing neuroinflammation. So brain rest is one of those. So you can do it through diet. That's a ketogenic diet. The second is good, true brain rest. That means you turn off the screens at a certain time, or you limit your screen time, or you limit your you take up some yoga for the breathing, and there's a direct relationship between full deep breaths on a regular basis, whether it's through exercise or other things. Exercise is a third item. There's recent publications on the reduction in frequency in dementias, and this can apply to brain injury. And those people who regularly exercise, whether it's due to blood flow or circulating paracrine biochemicals in the body, probably some of each, those are big ones. Proper restorative rest, whether it's 8 hours of sleep, or if you've had a brain injury, it could be 12 hours you may need. And this, again, is to reduce brain inflammation and improve the healing time. Supplement, you got to have your supplement game, make sure you have all the vitamins and nutrients. I am a big fan of probiotics, and I say that broadly, but soon we are going to have specific probiotics. We actually already do, but they're going to be more specific. There'll be some that are more neuro-friendly, and the gut-brain axis is a real thing. And although I did not learn this in medical school, it is there's plenty of science, particularly in the last 5 to 10 years, and comes out daily. Something about the commensal and mutual relationship we have with our gut microbiome, the bacteria in our gut, and how we don't get exposed to all the right diversity of bacteria that help us process our phytonutrients. So that's just a small list.
That's fascinating. A number of people have asked questions about. I've got comments for stem cell questions that are built up already before we even did the show, and people are asking about if I do a therapy that involves exosomes or exosomal therapy or stem cell therapies, what happens afterward? Am I able to take ibuprofen? Am I able to take acetaminophen? Am I able to take aspirin directly after those things? Does it affect the potency of those cells?
Yeah. So oddly, there's a yin-yang of some inflammation, but general anti-inflammatory effect of most of the regenerative biologics. I don't want to interrupt those. So when we do have patients that are having this approach, we tend to restrict the true anti-inflammatories. People can have acetaminophen if they have headaches or have another need, as long as they don't take too much, because that can be negatively impactful on the liver, of course, and other things. But yeah, we do limit ibuprofen, aspirin, things like this. We want to avoid steroids, the type of steroids that one would have for swelling or reactions to some type of allergen or asthma as much as possible. Of course, if it's life-threatening, you have to have them, but those steroids limit the benefits of the regenerative biologics.
Okay, so you should be careful, not to just indiscriminately gobble down these NSAIDs and other types of over-the-counter pills and prescription steroids and all of that. That's very good. Gosh, that's fascinating. Bill, what do you think about the concussion prevalence that we're seeing now? Are you seeing more in your practice? Are you seeing less? Are you seeing more women, more men, more children, more elderly? What is COVID doing with your incidence of appearance of these?
I was going to bring that up. I see it a lot more, and I don't know if it's because I'm focused on it a lot more, I'm concerned about it a lot more, or if there's actually more of it going on. And it was sort of like when a lot of times diagnosis will go up because technology gets better, or the criteria for diagnosis gets broader, and you can throw people into that bucket. But I've said for years is because the world's walking around inflamed, diets, general stress, poor sleep, everything else. So to me, it's almost like, we're holding back the tsunami that was holding back over, and you get one more thing that just tips people over. And COVID was pretty gnarly. I mean, itself being sick like that, but the real pandemic of fear mongering, people that were actually down. So the mental and the physical stuff, the worry about, is grandma going to get sick? What am I going to do? Where are my kids? Should I wear a mask? Trump or no Trump? I mean, it's just crazy. We're under so much stress, and we're harboring all this inflammation. It's just nuts. I mean, so I'll see a lot of car accident stuff where I'll see most of the thing, because they don't go to a chiropractor, because they've had chemical stresses. They're going somewhere else first in general. But I've seen, impacts that 10 years ago, people would just go, yeah, I was in a car accident, a little stiff, let's get over this. And we go, but now it's debilitating to them, because you have those same people with that same mentality. Yeah, it's like that. And their brain's not working anymore, because one, it was inflamed before because of all the crap that they've taken in. And then two, the overwhelming stress, and then the physical trauma, and it's bringing over. So I'm seeing it's harder, but I need in the trenches, when I'll say, like, for car accidents, that's where I see most of the patients coming from. So they're going to a chiropractor, and then the insurance companies will have a certain view of what kind of doctor I should be. So for me to recognize this stuff, I need a neurosurgeon and another neurologist going on, or something like that, to concur with what I've seen, but to also help with the data driven, saying, well, this is what the research said. And, they pat me on the head and they say, oh, that's cute, you look, let's go let the real doctors handle it. But if we can bring that out, and we can bring the data to the point and saying, look, this patient had X, Y, and Z, and they had this trauma, and then this happened, and this is the happen, and draw the lines for them, because we've got to open it up, because traditionally treating people like it was just, well, you'll get over it, wait a couple of months. This is killing people's happiness.
Wow. So somebody who has a whiplash in their neck, they've got a concussion in their brain, and then they get COVID on top of that, could really be in for a triple whammy. Yeah. And likewise, if they had COVID already and then they got a concussion during or after COVID and didn't quite heal, they could also be in line for a really bad time.
Well, and imagine if they were just the average American going over the last decade, who's eating a sad diet, who's sedentary, who has, one kid in college and a mother-in-law that they don't like, or whatever it is, takes moderate amount of alcohol, but you add all that stuff up and they're a hot mess. And then there's the whiplash, and then there's COVID, and it's Jack, dude. Putting it in California terms, yeah.
Yeah, just recently, Zach Bush, MD, the famous triple-boarded endocrinologist who was a cancer researcher, was talking about the use of NSAIDs in the gut and the immune system, and he was talking about how people have a much increased risk from even one dose of acetaminophen to affect their depression and their brain health and their wellness as far as mental health. And with two doses in the same short period of time, it was doubled. It was amazing how much problems happen with the brain from some of these NSAIDs that happen in proximity to the gut and the changes that happen in your gut.
When Jeff was saying that, I had a question too, like that. So the acetaminophen will actually go and affect the glutathione stores, right? So they're breaking that down. Jeff, what do you use? Yeah, I mean, frontline for the anti-inflammatory protection.
Well, it depends how open-minded the patients are, but I mean, we can recommend. I don't have it in my office, but go to IV center. You can get glutathione therapy. I do recommend that people consider various other supplements we really didn't get into. Proper amounts of vitamin D, not just what the RDA says, because that's just the number that prevents malnutrition. We want the actual number that is optimized health. So proper amounts of vitamin D, activated D, maybe a little sunlight, notwithstanding the risks to skin, we have to be cautious. There are now mitochondrial supplements. You talked about David Sinclair earlier, NMN, the mononucleotide is potentially very helpful. There are some people, including myself, who have been using metformin for anti-aging, anti-inflammatory purposes. The literature is good on that. And we can get even more creative and talk about rapamycin and rapalogs and things that activate or suppress the mTOR pathways. We could talk about DNA repair, berberine or hydroberberine, spermidine, things like this that are very anti-inflammatory and occur naturally. I mean, if we were eating of the earth organically, fruits and vegetables of a very diverse nature, we'd be getting these things. But frankly, we don't. That's why we have to supplement.
Perfect.
Very good. Very good. Well, we're gonna wrap this up in about 8 minutes or so, but I'm very pleased to have you guys on. What about mental health medications? We see a lot of people with beyond those medications you mentioned already. There's a trend in concussion and mental health to give medications for concussion and to give medications for ADHD. And I'd like to hear what you both think about that. And pros and cons and what you have going. Is frontline first defense a medication for ADHD and concussion in your view? And what factors makes that calculus change in your brain? And either of you can go first.
Bill, I'll yield the floor to you first, and then I doubt I'll need to fill in.
For mental health and concussion stuff like that, I always go to the same thing. I'm a big proprioceptive guy, and there's been no research of anything that you can take outside the body, put inside the body that's better than exercise and stimulating the proprioceptive. I also a big fan of people doing that outside in grounding. And if people don't know, grounding is just getting outside in nature where your skin is on the ground. And I always ask my patient, I said, all right, do you want to be the hippie reason or do you want the more science reason? I said, they're both valid. If you're a hippie and you just want to feel like you're one at the earth and you like tie-dye and patchouli and everything's kind of grounded and we're all happy and we can all hold hands and sing Kumbaya, awesome. It definitely works. But if we actually look at the reason why we're meant to be part of the earth, and the earth is a giant magnet that's giving off the negative ions, those are anti-inflammatory, those are healing and parasympathetic stimulating that's going on. And in fact, from the proprioceptive standpoint, if we have our shoes off and we're able to get our feet molding and stimulating more proprioceptive and getting the brain gently activated. You know, this is not a CrossFit workout. This is not a high intensity thing, but we're using all this other things. At the same time, we're outside breathing, and a stroll in a nice wooded park or down by the beach is restful for the patients, stimulating to the brain, to the like post concussion. It's building up those little muscles in the vertebrae that are our actual core muscles, and so we're getting better. So strolling is the first thing that I put on. I said, take a stroll. They go, well, how many? Everybody wants time and good. I said, till it feels good, and then go back and rest if it doesn't, and take care of yourself. That's the first thing that I do, and I'll see that with depression, and I'll do that with ADHD. My daughter has a tick of that. And then whenever I saw her start going like this, we're going for a walk, we're doing burpees, we're getting that brain moving, and then we calm down, and breathing. Nasal breathing is huge.
Gosh, Dr. Bill, that's fantastic. I want you to spend just a minute explaining to our audience what's proprioception and how does it affect depression or mental health? Just give a minute on that, if you would.
So the proprioception is just moving. It's how your body is perceiving its environment, where you are in time and space is basically. So most of the time, most of the stimulus that's going around us, we're really not aware of. It has to go in subconsciously. And actually, when we're looking at our subconscious, the subconscious is calculating 99.997% of the information coming in, which means consciously, we are only using 0.003% of what's going on in our head, but we want to think consciously. So when we're walking around, our foot, it knows that we're at a 3.2 degree angle, and there's a wind coming in from the northwest, and it's pushing on our skin, and we're getting all this information that's stimulating the cerebellum, which is on the back of the head. It's the thing that looks like a cauliflower in the back of the head. That then is organizing the thoughts and feeding energy into the brain going around. But you can do balance is perfect with this. I just have people stand in the corner, try to stand on one foot. If you watch that ankles, and what I tell my patients, that when you wobble like this on your ankle, that's kind of analysis of what's going on with your spine. Or if you even think about your brain, it's unstable. But when you get a nerve to fire from those proprioception, and a proprioception happens every time a muscle stretches or compresses, or a ligament or tendon or fascia, bone, skin, all this stuff is going, and it's lighting up the brain. It's like a dimmer switch that you get to turn off, but it's all going on behind the scenes, almost like recharging your battery. So now you have some of that energy in the neural energy to take out and do this. So we use that in car accident stuff, because that proprioception will also block out with the pain gate theory of pain. I always tell the patient, I said, there's like two freeways. If you have, like in California here, we have the 91 and the 5 coming together. If all the fast cars are on the 91 and you have some of these other ones, the cars from the 5 can't get to the destination. So we're blocking it out with movement. And at the same time, we use that energy to get the lobes moving around. And some of the great exercises, stuff that I've learned from you about how to stimulate the lobes, then we can regenerate that thing. But it works with depression and ADD and ADHD. It's not the panacea. It's not like the thing that you have to do, but it's a huge, huge component to make sure that you're plugged in to do the rest of it.
So there's
that's
this,
how I use it.
Marvelous. So there's this little known idea that the audience really needs to know about, which is that the sense of where you are in space and how you're moving through your bones and your joints and the nerves in your muscles can affect your depression and your mental health. And this is something that really is revolutionary for a lot of people. They don't know that the sense of movement and the sense of position can affect your brain and your mood and your emotional state, your ability to cognate and think and process. That's huge. All right. Well, we've got to wrap this up. I'd like to give the last word. We've got 1 minute left. I'd like to give the last word to Dr. Gross. Is there anything else you'd like to tell people about concussions and the cutting edge world of brain injury? Anything at all you'd like to wrap up in the last minute here? You've got the last word, sir.
Yes. Thank you. And Bill, I agree with you 100%. We're designed to move. So I wanted to, the proprioception sends signals to the brain, and these are, refining that wiring or rewiring is so crucial. But yeah, listen, don't settle. If you or a loved one have a dementia, or a brain degeneration, or brain inflammation, a brain injury, a concussion or concussive brain injury, there's more than you can do besides give it time. And you need to take an active role. It's probably not going to come from a traditional institutional medical pathway like a hospital or an HMO or someone who was trained 20 years ago and hasn't gone back and seen what's new or opened his or her eyes to the non-traditional medical pathways. There's a lot. There's thousands of years of experience in Chinese herbs.